Hey everyone, welcome to Spring Quarter ITS Seminar. This is an adventure for all of us doing this online. We appreciate your patience as we work out any bugs. I think it's going to all run smoothly, but may take us a little bit to get the routine of it. So before I introduce the speaker today, I just want to kind of go over how we hope this is going to work. During the talk, feel free to use the chat box, and I, as the host, will keep an eye on it, and our speaker, Kevin Fang, may also be watching it as well. But try and keep those questions to sort of quick clarification questions. And then at the end of his talk, we'll open things up for live Q&A. And to do that, we want to try using the raise your hand option, which some of you may by now be familiar with, but if you open up the manage participants or the participants icon from the bottom of your screen, and you'll see your name, and there's an option for you to raise your hand. And that way we'll be able to call on you in an orderly way. And at that point you can unmute yourself and ask your question live. During the talk, please be muted so that we don't get a lot of background sound. And then video is entirely up to you. We'd love to see your faces, but do not feel obligated to turn your video on. Okay, and then the other little bit of business is about the grading. And yes, so it's the same deal. You're supposed to submit your 3 questions via Canvas. And I'm not quite sure what's going on with the quizzes. Somebody is talking about that in the group chat. But assume that you're just going to be submitting them in the regular way via Canvas. And of course, you can do that while we're listening to the talk and just be done with it. But recognizing that you may all not be able to participate live every week, we are going to record these sessions. As you heard, the recording has already started, and we will get those posted hopefully by Monday of the following week in the usual spot that the ITS seminars are posted. And then you'll have until Thursday to submit your questions. So if you can't be here live, look for the recording and just make sure you get the questions done by Thursday. But we're hoping that most of you can be here live because it's nice to see you all and have some, some questions and some interaction. We'd like to make this as much like the regular seminar as we can. Although unfortunately we can't get some nice refreshments out to you, but maybe we'll save some money and have even nicer refreshments in the fall when we're all back. Okay, any logistical questions in the chat box, or unmute yourself before I introduce our speaker? And again, be sure to put something in the chat box if something seems to be going wrong. All right, I'm not seeing any questions. So let's turn to our seminar. And I am delighted to introduce today Dr. Kevin Fang, who is a graduate of our very own TTP program. He finished his PhD here with me, I want to say 3 or 4 years ago now, and is now an assistant professor in environmental policy and planning. I probably don't have the department quite right, at Sonoma State University, just to the west of here. And Kevin, he came to me when he was a second-year student or so and said, I'm thinking about, well, I could do a dissertation on transit-oriented development, but I've also got this idea that skateboards as a mode of transportation is something nobody's looked at and could be a pretty interesting thing. And at first I thought he was a little crazy, and then I thought about it and I said, why not? Let's take a look at that. And so he did some really interesting work in a lot of different aspects of the use of skateboards as a mode of transportation, and was exactly in the right place at the right time, because this was just before the takeoff in these scooter share programs. So he's really been at the forefront of research about these programs and about how people are making use of these scooters. So I'm delighted to have him here today to share with you the work that he's been doing in this area. So please join me in welcoming Kevin. And I guess you could unmute briefly and clap. Could we try that? I'm going to unmute you all. Clap. All right. Okay. Kevin.
All right. Well,
whoops. I think I muted Kevin. Oh, Kevin, unmute.
All right. Thank you, everyone. And thanks, Susan, for the introduction. Definitely glad to be here for the seminar. Sad I couldn't be there in person, but I'm not too far away, so I still do make it out to Davis from time to time. So yeah, as Susan mentioned, I am currently assistant professor over at Sonoma State University in our Department of Geography, Environment, and Planning. Yeah, so Susan mentioned, I guess it was about 10 years ago now, I came and saw her about potential dissertation topics. And then I thought I was a little nuts too when suggesting skateboarding as a potential topic. But then, as Susan mentioned, it started out working out here in the last few years with the rise of other, the term I had somebody tell me once was esoteric transportation. And with the move towards scooters and lots of other small devices here in the last few years, it's sort of become a growing area of research. All right, so today I'm going to do a few different things here. So I'm going to start off by talking about the rise here of micromobility devices, micromobility vehicles, including scooters, here over the last few years. Then sort of for the bulk of the talk, I'll focus here specifically on scooters and talk about what does the very early research here in the last couple of years have been on various e-scooter controversies, for which there have been many. And then to wrap things up, we'll talk about existing policy and then some thoughts on potential policy changes as so we contemplate the issue of scooters as they become more present in cities. Before I start here, I did want to acknowledge some of the people I've been working with on some of this research here over the last 2 or 3 years. In particular, my main collaborator, Professor Asha Weinstein-Agarwal at San Jose State University, and then our team of student research assistants, including Ashley Hooper at UC Irvine, Frank Ariano, John Hunter, Sasha Landry, Alvarina Weinerdy from San Jose State University, and Jeremy Steele from McGill University in Toronto. Okay, so starting off here, so let's talk about, before we get to scooters in particular, so let's talk here briefly about sort of the whole suite of the many different kinds of small kinds of devices that have appeared in the last few years. So as Susan mentioned, I did my dissertation research on skateboarding in particular. So we've got skateboards, we've got e-skateboards, we've got human-powered scooters, and the e-scooters that we've seen adopted in the scooter share systems in cities around the world. Lots of other devices that people have been inventing and using. What was it, about 5 or 6 years ago, we had the whole kind of holiday season of hoverboards before they flamed out a bit, literally. We've got Segways, of course, from a couple decades ago. We've got different kinds of other devices that people are inventing, various types of e-unicycles. On bottom left, we have the Solo Wheel, a unicycle / skateboard hybrid. If anybody knows Hanji, that's kind of his mode of choice there sometimes. So he's got one of those. And so lots of these things that have been emerging and continue to emerge as different inventors come up with different kinds of devices that can carry one person on these faster than walking trips and trips that maybe perhaps approach bicycles in terms of their capabilities. Now, as these different devices have come out over the years, and then particularly when scooters came upon the scene in late 2017, early 2018, there was lots of different names that were being used to call sort of this suite of different vehicles here. So looking at some of the news headlines that were describing this trend as they appeared, we had little vehicles, personal transporters, personal transportation devices, personal mobility devices, and then last one there from Europe, last mile electric vehicles or personal light electric vehicles. So we had lots of different names, and we hadn't sort of quite settled down on what to call all of these things. But sort of things have settled in here under the umbrella of micromobility over time as sort of the term of choice. And so now we are starting to get a little more mature here in our terminology for these different kinds of vehicles. Late last year, the Society of Automotive Engineers, they have had put together a committee here to come up with sort of the naming conventions and sort of ways we could think about different kinds of micromobility vehicles. So they released here their taxonomy and classification system for powered micromobility vehicles. I would consider the definition of micromobility to include non-motorized devices as well, but being a mechanical engineering sort of organization, they focus here on the powered devices. And so here they're focusing here on their scope, micromobility vehicles being those designed for transporting one person, and then focusing on things that can travel in cities on paved roads. So including fully powered and partially powered or power-assisted kinds of devices, and then roughly under a 30-mile-an-hour speed limit. So that's kind of what they're including here as the universe of micromobility devices. They also included here a set of sort of primary criteria by which we can sort of classify and also then categorize different micromobility vehicles between each other. So some of the key characteristics that the taxonomy focuses on here: weight, size in terms of the width of the vehicle, and thus how much lane space or pathway space do they need, speed, and then power source. So scooters, as we've been considering them here lately, mostly electric powered, but we do have combustion engine powered micromobility vehicles as well. And then they also came up here with trying to define some of the differences between some of the different kinds of micromobility vehicles that we see now. And so differentiating between things like whether they have seats, whether they have a center column that goes vertically, so scooters do, skateboards don't, and then whether some devices like Segways include a self-balancing feature or not. So again, this is still kind of an evolving vocabulary for micromobility vehicles, but this SAE taxonomy at least tries to get us a little bit clearer into what it is that we're talking about. Now, of course, what has really been driving this conversation has been the appearance of the shared e-scooter systems in cities, again, around the world. So the device that we are particularly looking at is the electric version of a kick scooter. So like your kid's Razor scooter with a electric motor and a battery on it. Now, one thing that gets a little bit tricky when we talk about scooters, and so something to keep in the back of your head as we go along here, is while today, when people are thinking about scooters in cities, we're thinking about this, again, sort of electric version of a kick scooter. But if we look at the suite of devices where the term scooter is used, all of these devices here, ranging from human-powered, electric-powered to combustion engine-powered, and then ranging in size from something that a small child could ride to things that look like motorcycles. These are all things that are marketed with the term scooter. And so that is something that does get a little bit challenging when we consider data on scooters and think about policy on scooters, since there is kind of a wide variety here under the banner of the word scooter. All right, but for today, we'll be focusing here mostly on the electric powered version of kick scooters that we've been seeing on scooter share systems. Okay, so since these have arrived in cities, there has been a very wide array of reactions to them, which if you've kept track with news stories on scooters, can be pretty apparent. On one hand, you'll see very positive spins on the potential of what scooters can provide. So we've got this headline here that scooters could be the future of urban transportation and could be a major piece of our kind of future transportation options. Since scooters were adopted in cities, so they have become quite popular, comparing scooters to past transportation revolutions, sort of their first and second year ridership numbers compare quite favorably to things like bike share and TNCs. Polling data, so this was a survey that was conducted by the firm Populous in early 2019. And so they surveyed adults in 10 cities around the country, and they found for the most part there were super majorities of people had positive opinions about scooters, with San Francisco, perhaps not surprisingly, the notable outlier, but still even in San Francisco, net positive reviews for scooters among adults. But then in all the other cities, 67% up to 79%. Now, there has been a bit of a perception with scooters that, oh, this is just something for, wealthy young millennials in cities. But their survey data also found that the popularity spreads to more than just stereotypical tech bros, if you want to put it that way. And so looking at favorability of scooters among different income groups was actually rated higher among people with lower incomes generally than people with higher incomes. Although again, clear majorities for all income groups. Now, on one hand, while there have been these positive takes on scooters, there have been more negative takes as well. Now, this is a headline from the Wall Street Journal. It's a little bit, perhaps, tongue-in-cheek, but talking about how scooters are sort of terrorizing cities, and they're sort of a scourge and something that we need to purge from cities. And again, while this one may be sort of a sarcastic headline on this one, this is definitely something that lots of people in different places do not like, and do not like quite vehemently. Interestingly enough, if we look at, there's several cases of this from around the country, but we have several cases here of politicians running on overt anti-scooter platforms when running for office. One of the primary challengers in the San Diego mayor's race, so this is a big city mayor, race, you have a serious candidate running on kind of an overt anti-scooter platform. This here is a screenshot of part of that candidate's website, and they're about halfway down the list of their priorities. They've got scooters up on there, and this particular candidate has listed scooters as more important than land use, which might be shocking to all the planners in the room, more than pay equity, even more than public safety. So we care more about scooters than we do about crime, potentially, in San Diego. And this particular candidate's had lots of negative comments about scooters, even at one point calling them sort of, they're not actual mode of transportation, they're just a get-rich-quick scheme that startup companies are just trying to make money at the expense of destroying our neighborhoods with their presence. So, very positive, and then here's some very negative views of what scooters mean for cities. Now, when different people have sort of complaints or worries about scooters, there are a number of different controversies, and a few of them I'll cover here today. So some of the main ones that have popped up here early in the existence of scooters have been the idea of parking of scooters and their presence as sort of being clutter or litter in cities. Lots of attention paid to the potential safety or unsafety of scooters. And then sort of related to that is the idea of whether scooters are compatible with other users. So maybe they're dangerous to themselves, and they're also dangerous to the safety of other users and the operations and the flow of traffic for other modes of transportation. All right, so those are some of the main controversies here. So let's take a look at, again, what does the very early research on scooters tell us about some of these controversies. So let's start here with the idea here of scooter parking. All right, so a couple years ago, a team and I, we started looking at the parking behavior of scooter users, and we did this study here in downtown San Jose. So I had sort of my team of research assistants. They went around the streets of downtown San Jose, took a lot of photos. Then once we got those photos, we went and coded what was going on with all of these parked scooters. And so this was only about 6 months after scooters appeared in San Jose. And one of the things that we found was, despite that they were pretty new, there weren't a lot of regulations, there wasn't a whole lot of guidance as to what to do with a scooter. We generally found that there was sort of this establishment of norms about how to park scooters. And for the most part, we found that we're sort of generally here out of the way, even though they are another thing that you see when you go down city streets. For the most part, they weren't particularly poorly parked. So one thing that we found was that the vast majority of scooters, so 72% of them here, were parked on sidewalks. And then 23% of them we said were on private property, although they were more or less still sort of on the realm of sidewalks. So in the photo up here on the right side, this was sort of what we generally saw with the private property park scooters. They were basically, the sidewalk here and the space between where we think the public right-of-way ends and where the private lot begins. It's still a continuous space, but we thought it was on it was here tucked into the facade on the private property side of the line rather on the public property side of the line. Now, given that pedestrians are already sort of limited to kind of the narrow strip of sidewalk on the side of roads, the fact that most scooters were parked on sidewalks, now some people found that to be kind of a problematic kind of idea, and that's some of the controversy over scooter parking. But when we dug deeper into how people were parking scooters on sidewalks, we generally found that, again, scooters were parked generally out of the way when they were on sidewalks. So a little bit more than half of people who parked their scooters on sidewalks were leaving them on the edge of the sidewalk. So some part of the scooter around at least a foot or no more than a foot off the edge, either off the curb or off of the interior edge of the sidewalk. And then about 38%, so most of the other scooters on sidewalks were parked in what we referred to as the street furniture zone. And so that is the part of the sidewalk where, sure, scooters are there now, but these were the part of the sidewalk where things were already present that prevents that width of the sidewalk from being used for throughput of pedestrians. So as we see in this photo, things like street light poles and fire hydrants and newspaper racks, benches, trash cans. So sure, scooters are adding something to the sidewalk, but they really weren't impeding pedestrian flow in ways that weren't already impeded. So we also, we looked at the photos, we tried to come up here with a measure of, okay, well, how many of these scooters are poorly parked? So we came up with a definition here for what we were considering the blocking of a sidewalk. So we define this as the obstruction of a door, infrastructure utilized by persons with mobility disabilities, such as ramps or curb ramps. And then taking the rule that the city of San Jose had for bikes that were parked outside of bike racks, we also looked for whether scooters blocked more than half of the width of a sidewalk. And it turned out after we were looking for these three particular characteristics, we found that only 11 of the 530 scooters that we observed could be defined as blocking the sidewalk in some way. And so the photo I've got here was the only case we saw of scooters, in this case 2 scooters, sort of conspiring to block more than half the sidewalk. And then even then, it's a little bit of a toss-up as to actually whether half the width there is blocked or not. So we did this study in parking. Different cities have done their own looks at parking in their cities as well over the last year and a half. And again, similarly, I'm not finding as many issues with parking as perhaps has been discussed sort of in the media. And then just last month, a team led by Ann Brown at the University of Oregon, including former ITSer Calvin Thigpen, they worked on a study last summer looking at parking of multiple modes of transportation in 5 cities across the country. And they also found that the vast majority of scooters were parked in a way that wasn't blocking sidewalks. So they even sent a team of research assistants out with tape measures to go measure whether there was ADA compliant widths. And so they found for the on average is about 1% of scooters might have been parked improperly. And that was much less blocking than we see with cars. So the car rates in all but one of the cities of parking violations was up over 20%. And that was even higher when you look at TNCs and delivery vehicles, which I think raises a sort of a larger question about our allocation of curb space. Should it all be for vehicle storage in a kind of delivery world where delivery is common? And then, interestingly, they also found that not only did scooters block things less than cars, but particularly in the case of sidewalks, so other sidewalk objects, so things like advertising that different stores put up outside their establishments, those things block sidewalks even more than scooters did as a percentage of the time that they existed. So, so again, more evidence here of, again, maybe some of the controversy over scooter parking is, again, not as serious as it perhaps has been portrayed. Now, different cities, trying to be sensitive to concerns over parking, have set up various methods to allow people to complain or report scooters that may be parked improperly. Those still do occur. And so going back to the case of San Diego, they've got a system where citizens can report scooters that may be misparked. And so just a random citizen did a public records request of the complaint data. And so what this person found was that 74% here of the scooter complaints that were made in San Diego came from the same 10 people. And so there weren't a lot of people who were complaining about scooters, but there was a small number of people who were complaining a lot about scooters to the tune of over like the 2 months of data that this gentleman here pulled, there were approximately 10,000 reports. And then the vast majority of them came from, just 10 people. So again, sort of indicating that some people really don't like scooters. But again, sort of the data is telling us is that maybe it's not as serious an issue as we might think. All right, so that's the parking story. Now, one of the other big ones that people have been really concerned about, and this has sort of been continuing here here over time, and that is the issue of scooter safety. So lots of, again, we look at the news media, you'll see lots of negative headlines over potential worries about scooter safety. So we've got here, now that there's scooters exist, there are measurable numbers. In this case, a few hundred injuries from scooters last year, several deaths. And then in the second headline here, we've got another newspaper headline calling figures such as the one in the first headline as an alarming number of injuries. So definitely some people very concerned about scooter safety, think they are particularly unsafe. And others, they're maybe not quite as alarmed by the injuries. Now, when we look at some of the research digging into the safety data, most of the initial publications that there have been done on micromobility safety have generally been in medical journals based in the US. And so, this is a transportation issue. We haven't necessarily seen a lot of transportation safety literature, and we also haven't yet seen a lot of literature from outside the US. But the U.S. Medical authors have been sort of very quick here to pick up on sort of scooter safety issues. Now, one of the things that this U.S. medical literature has typically been discussing is, it's like, okay, injuries occur. We don't like that these injuries are occurring. And so the thing that pretty much almost universally, sort of the half dozen or so different articles in the medical literature on micromobility have been tending to be very prominently recommending personal protective equipment. So basically helmets, and sometimes even more than helmets, so helmets and knee pads and elbow pads and the like. Now, while of course, sort of in today's pandemic world, PPE is all the rage right now. When we look at transportation research and public health research into vulnerable transportation users, personal protective equipment like helmets tends not to be the things that the literature outside the medical field is typically recommending for things like bikes. So when we look at the bike statistics and bike helmet rates, the safest places in the world to cycle have almost no or very low rates of helmet wearing, and the places where people wear helmets the most, and some of the places around the world where helmets are required, have some of the poorest safety outcomes for cyclists. So just showing some of the data here, highlighting that. So on the left, a place like the US, relatively high helmet wearing and also relatively high bicyclist fatality rates. On the flip side, you go to countries like Germany, Denmark, and the Netherlands. The vast majority of users don't wear helmets when they cycle, and their safety performance is much better than here in the US. So again, outside the medical literature, PPE tends not to be a very common recommendation. Looking even here beyond transportation, this is CDC guidance for workplace hazards. And so here they have something that they refer to as the hierarchy of controls. So these are different kinds of things you could do to try to mitigate the impact from certain harms. And basically they rate PPE as the least effective thing that you could do to deal with a hazard. So it is a little bit interesting that you've got your kind of nationwide public health officials saying, in general, in similar kind of situations, PPE is not a top recommendation, but then that's sort of where the initial here U.S. medical literature on micromobility vehicles have been very highly focused on it. Now, something else that has also been interesting when looking at the medical literature is, again, I'll use the word alarm here, over the total number of injuries being seen. So, so much of this early medical literature, and then particularly articles in the media that have been picking up and reporting on that literature, have made a big point that's like, oh, there's several hundred or kind of low 4-digit numbers of injuries. That must mean that these devices are unsafe, and which that we see injuries occur. I mean, at least in my opinion, isn't terribly surprising that there are injuries now that something exists compared to 3 or 4 years ago. There weren't injuries because scooters in the form that we see them now and the numbers we see them now didn't exist. So kind of course, they went up. And so, but so far, again, a lot of the reporting has been hyping up there's this increase in numbers, and that's really problematic. So I've included here, this is from the instructions for authors from the Journal of Transport and Health. And they particularly note to authors that the fact that you just see more injuries when there's more travel occurring, that doesn't really tell us anything. So it's not very enlightening, as they put it. There was nothing of it before, there's a lot of it now. We should expect to see more of it occur. I mean, so for example, I mean, this year there will probably be far fewer injuries on scooters as everybody's staying at home. And that, of course, didn't mean that scooters all of a sudden became a lot safer this year. It's just there wasn't as much riding going on. Now, while that, to me kind of seems obvious, that has, again, a lot of the discourse has been hyping up on these total numbers. Back in January, there was, now this wasn't a full-on paper, it was sort of a short research letter, as they called it, in the Journal of the American Medical Association's surgery subjournal. And so they looked at scooter injuries and ER visits in the US from 2014 to 2018. And they saw, particularly here in the last 2 years, as e-scooters have appeared, there have been an increase in total scooter injuries. So again, harping on the total, and then saying that increase in the total number of injuries was reason enough for more regulations and safety measures such as helmet wearing. So again, going on the PPE track. So this, again, focusing on total numbers, there was kind of a lot of sort of criticism of this article from the transportation sphere in particular. Here is a tweet from USC planning chair Marlon Bournett. And so where he's basically calling out the idea here that if you want to learn about cities and the issue here with scooter injuries, don't look at a medical journal. You're better off looking at something like Street's blog, where they took account of the idea that these became more popular. That is sort of a big reason why the numbers have gone up. And what we really need to do is take a look at the rates at which these injuries are occurring. Okay, now the data that was talked about here in this JAMA surgery article, they looked at data through something called here the National Electronic Injury Surveillance System. And so this is a U.S. Consumer Product Safety Commission database that tracks the number of injuries that result in emergency room visits that are associated with the use of consumer products. So if you want to figure out how people get injured by following televisions or toasters, and this is the kind of the place you can go. And they include data here on devices, including scooters. And so it's got some information here on who gets injured, the characteristics of injuries, and it includes sort of a one-sentence description about each patient, which can give us some insight about the circumstances of someone's injury. Now, so again, this JAMA surgery article, as well as some of the other early medical pieces on micromobility safety, have used this database. Now, the JAMA surgery piece, and pretty much everybody using this database, reported the total numbers of injuries, and then those critical of of pieces like this have focused on the fact they're showing these totals and are not calculating the rates of the injuries. Now, one thing that I will note, sort of in defense here of the JAMA article here, is they didn't calculate rates because it's pretty much impossible to calculate them based off of existing available data. So we pretty much don't know how much travel is occurring on scooters in total. We have some indications from certain cities, certain numbers reported by individual operators, but we really don't have sort of a whole lot of data on total numbers. And so thus, we don't have denominators with which to calculate rates. And so that makes it a little difficult to tell the rate story. And then also complicating this is we've got devices that can be used for travel and recreation. And then we also have shared and personal ownership of devices like e-scooters. And so even if we did get, say, data on the amount of miles traveled on shared e-scooter systems, which might actually be fairly easy to get compared to other kinds of data, then we still don't know how much private riding is going on. And then we don't know how many injuries in the NEISS database were travel versus recreation. And so that does make it difficult to tell us how dangerous these devices are for their use for transportation. Now, something that was a little bit interesting to me when the JAMA surgery paper came out in January, I was actually on my way to TRB to present a paper that I was working on using that same NEISS data over the same 5-year period that the JAMA surgery paper was looking at. And so when I saw that they were looking at total numbers, and that was kind of all they showed, that piqued my interest a little bit, as I was thinking, it's like, I'm looking at the same data set, and I think I've got better numbers than they do, or at least more nuanced numbers than they do. So one of the things that I was trying to do with my safety data, so again, like the JAMA surgery authors, determining rates is kind of impossible. Total numbers, like we saw from the guidance from the Journal of Transport and Health, doesn't tell us anything. And so what is the next best thing we could do with this available data? So what I decided to do with the data here was look at, when an ER visit occurs, so we've got that tracked in the data, what % of the time, so not looking at totals, but let's take a look at what some of the factors are, what some of the circumstances are, what some of the injury outcomes are, and let's calculate the percentage of time those different circumstances or outcomes occur. And then to provide context, I'm going to look not just at scooters, but let's try to pull this for a number of different micromobility vehicles, and let's compare them to each other. And then where available, let's even compare them to cars if we can. And let's look at these data in context, and essentially let's take a look at it as if we were looking at crosstabs of percentages, comparing the different rates of occurrences between these different modes. So download a bunch of the data and then try to calculate a bunch of percentages. And so some of the, so I got big table warning here, but so some of the kind of main findings from looking at this data set, again, looking more at percentages than in total. So one thing that we can tell from the data set is, so micromobility vehicles, perhaps unsurprisingly, are generally could be considered vulnerable users of the transportation system. There is some variance here in the frequency where someone gets admitted to a hospital when they show up in an ER with an injury related to the use of a micromobility vehicle. So some are lower, some are higher, but in general, most are higher than the admit rate compared to when people show up to an ER with an injury from a car crash. So that's 6.6 for cars, and then here for bikes and scooters, it's more than 10%, almost 15%. And then motorized bicycles is particularly high there at almost 30%. So you're vulnerable users, but I mean, scooters, I mean, that's pretty similar here to bikes and even lower here than motorized bicycles. Now, one of the things that, again, in lots of the medical research was focusing on was, number of head injuries. And so here, taking a look at that, the head injury shares among micromobility vehicles, now this was fairly consistent among different vehicles here. And so they're sort of in the high teens in terms of percent. Now, while we, of course, would rather people to not get head injuries, it turns out that the head injuries suffered by micromobility vehicles, that may actually be a lower percent of the time than when people get head injuries from motor vehicle crashes. I haven't yet found an exact number on this, but sort of as a low baseline here, at least 20% of people who get into car crashes end up with a head CT scan. So that's at least as many head injuries there are, and that's higher than scooters, higher than bikes. So, do we really need car helmets if we're going to be consistent about PPE recommendations? And then also here, comparing, what of these vehicles we see the most of. Generally, I found fairly similar outcomes between bicycles and motorized scooters. So similar hospital admission rates, similar head injury rates, similar face injury rates, and then both were arguably a little bit safer, at least here in terms of hospital admission, than motorized bicycles. So again, people finding a lot of alarm with scooters. But again, it really does not appear to me, at least, that there is a whole lot of difference in the safety issues of scooters than we see with bicycles. So here from this data and looking at it, so again, I found scooters and bikes are mostly similar. But then what I also found kind of interesting is the medical literature has been finding that scooters have been mostly worse than bikes. Even that JAMA Surgery article that looked at the same data set that I did over the same 5-year period, which made me think, well, how come our numbers are so different if we're looking at the same data set over the same period of time? And so I think there's a couple of things going on here. And so I think part of it is losing some of the transportation nuance in some of the medical literature. So for example, to me, it does not appear that the medical literature using the NEISS has filtered data on injuries by location. So for the most part, I think most motor scooter injuries are occurring on streets or other public property like sidewalks and pathways, whereas bike injuries are occurring over more kinds of places. So they occur on streets and sidewalks and pathways, but they also occur at home, parks, schools, places where people recreate. And so do we really want to be comparing the rates? So this is not an apples to apples comparison. And so perhaps we should not be surprised that the bikes were appearing to be safer when we were including non-transportation or likely non-transportation related injury cases in the data. And then beyond that, it also did not appear that the medical literature using this data set were cleaning up the scooter data from the NEISS. They just took the category that includes scooters and they were sort of counting all the cases in there, which you could do, but if you looked in more detail at the descriptions of each case, you'll find that maybe up to a third of the cases were mopeds that were miscategorized in the scooter category. And so mopeds larger, faster than electric kick scooters. So I think that was also then, we're probably not filtering out the bike or injuries and making that look safer, and then we were including moped data that made the scooters look more dangerous. So I think some value to be had from looking at it from a perspective that takes into account some of these transportation nuances in the data. One caveat that I also like to make here with the data is the NEISS can only tell us about scooters, and what I'm going to use here, scooters broadly defined, since we cannot differentiate between the different types of scooters we saw earlier. So it could be the electric kick scooters, it could be the motorcycle type scooter. It all depends on what the patient and what the person entering the data defines as a scooter. If they call it a scooter, it's going to end up in the data set. And so a lot of the medical literature looked at the scooter data and saying it's only telling us about electric kick scooters, when in fact it may be telling us about a much wider set here of different kinds of devices. Okay, one more thing of note here from this NEISS safety data is if you dig into the details for each case, we can also tell, and this is again something that the medical literature hasn't looked at, is taking a look at the role and frequency here of vehicle collisions. And so perhaps unsurprisingly, when a vehicle collision is not involved in injury, people tend not to get admitted to a hospital from a micromobility vehicle injury. And then that rate of hospital admission goes up by a lot when a vehicle collision is involved. And so, again, there's been a lot of talk about in the medical literature about, okay, people need to slap a helmet on. But again, it looks like here the real risk and the thing that's really driving hospital admissions here is the presence here of vehicle collisions. And so, you know, how much does a helmet really help you against being hit by a car? Yeah, that's pointing at other kinds of interventions more from like a facility design standpoint. So something that also becomes apparent when looking at vehicle collisions is we can look at where injuries occur in the data. And so generally, looking at our different micromobility vehicles, the vehicle types that are ridden more on roads, as indicated by more of the injuries occurring on roads than not on roads. Usually, the more riding on roads there is, the more frequent that you get admitted to a hospital when you get injured on one of those vehicles. So bikes, motorized scooters, and motorized bicycles ridden on streets relatively more frequently, they have relatively high hospital admission. And then type concealed devices here at the bottom. Now, I can't tell this for sure, but I think that is most likely segways, which if you see them, we most often see them on sidewalks. And so not a lot of injuries on streets with these, and they had the lowest hospital admission frequency. Okay, so that's some of the insight that we could tell here from the national data. Now, there are local safety studies that people are doing as well. So I think some of the issues with the data availability and the comparability of data at the national level, we could avoid that in more local studies and where we have the opportunity to do things like write surveys and do interviews and dig deeper than just the stock data that comes from a national data set. That said, when we look at the local studies that have occurred, their sample sizes have been very small, since in one city you may only get around 100 cases over a few month period. And so I think we'll end up needing to look at both the larger national data set for numbers, and then for detail we'll need to look at these local studies to get the full picture on safety. One of the more notable local safety studies done back in 2019 was one done in Austin, Texas. So there they looked at cases where scooters were mentioned in hospital records, and then they went and interviewed patients, and then were able to tell quite a bit more detail about the circumstances and sort of reduce cases that were irrelevant to a greater degree. And one of the more interesting things they found in this particular study was that new riders, so those with 10 rides or less than 10 rides of experience, accounted for 63% of the injuries on scooters. So I think we have the safety picture that has occurred in the first couple of years that scooters have existed. Given that most of the injuries are by new riders, I would suspect that the injury picture would look different after people riding scooters are generally a more experienced population over time. Okay, so that's some of the numbers here on safety. Before I move on to the next topic, I think one thing that is a little bit interesting here when we think about safety is a question here as to what is sort of the takeaway that we want to get from the safety data. So again, I'll use the word alarm here. So several of the existing literature pieces have raised alarm over the total numbers. Generally, my take has been sure they're occurring, but it's pretty similar to bicycles. To which, I mean, I've gotten the response, well, aren't you being dismissive of safety risks? Because, you know, this bike safety situation, you know, could be better. And so saying that it's just as good as bikes, it's like, so it's just as good a situation that we would like to be better. And so while I would agree that I think for all modes, we would like to increase, you know, safety performance, I think it's also important to take a look at, you know, levels of consistency and sort of not overblowing things for one mode that we don't for other modes. So let's put everything in its proper context. So that's definitely something that there could be some differences of opinion on. Okay, moving on to one more set of characteristics here. Some data here on rider behavior, and we could use this as another indicator for potential safety issues that we might see with scooters. So one of my former students did some observations of rider behavior, also in downtown San Jose, like our parking study. He looked at speeds of scooter riders, among other characteristics, and he broke it down by sidewalks, mixed-use paths, and streets. Generally found here that scooters here between 9 and 11 miles an hour, with riders knowing that streets are, or at least apparently knowing here that streets are, they can go faster, but on sidewalks there's more obstruction, so they go slower. So once you added some pedestrians on mixed-use paths, people slowed down from 11 to 9.5, and then on the sidewalks, people slowed down to 9 miles an hour. Some differences by gender too. In particular, female riders slow down more on sidewalks than male riders do, despite riding about the same speed on streets. All right, comparing it to other users. So on sidewalks, so scooters are you know, quite a bit faster than adult pedestrians. So it's about 2.5 times faster. So there's an open question there about whether that's compatible or not, but that's the numbers that we see there. Joggers, so people running fairly close to scooters here, but still scooters are a couple miles an hour faster on sidewalks. And then looking at some wheeled devices, scooters, people on e-scooters are a little bit faster than people on skateboards, but not as fast as people on bikes. But again, it's pretty close. So within a mile per hour of bikes, and then within a couple of miles per hour of e-bikes. So the fact that at least I was finding similarities here between bikes and scooters in terms of safety performance, that's probably not all that surprising, given that their speeds are pretty close to each other. All right, so that's some of the data that's available here on rider behavior, at least here in terms of speed. Okay, so to wrap things up, let's talk here about some of the policy implications for scooters in cities. So they're here. People have been riding them, so millions of trips in cities. So I think there are sort of two big questions to ask ourselves when we talk about policy. One is you've got people riding these devices, whether they're shared or whether they're privately owned. How do we want people to operate their devices in cities? And then secondly, given that much of the ridership is coming from these dockless shared scooter fleets, we also have policy questions related to how do we manage those fleets. So for the most part, there are kind of no normal policies on scooters, given that they are still very, very new. Cities are trying to, they're quickly writing more regulations on things, but the regulations at this point are either non-existent still, or the ones that do exist can have a lot of variability between them. So this is something that one of my research teams at San Jose State took a look at. So we looked at the regulatory environment for a large number of what we were calling at the time personal transportation devices, so a little bit before micromobility stuck. And so we were looking here at the rider behavior piece of policies. And again, we either found non-existent policies or inconsistent policies. For example, lots of variance between places. So this is here, motorized scooters on sidewalks. Again, most states didn't have a policy on this, but 4 states said you cannot, 2 states said you can. So some opposite opinions in there. And as if can or cannot wasn't opposite enough, then there were some cities that said you must ride on a sidewalk because scooters were quote unquote toy vehicles and thus shouldn't belong on streets at all. So again, some very opposite regulations for the same device in the same situation. Even in the same place, you can have lots of variation on devices that are pretty similar. So these are some of California's rules on e-scooters and e-skateboards. People use them for the same purpose, travel the same speeds, but they differ on helmet requirements, driver's license requirements, and sidewalk riding rules. So given that they have similar operational characteristics, you figure that maybe the policies should be kind of similar, but they're not. And then we also see that when rules are present, the rules on micromobility vehicles are often restrictive in ways that conventional modes, such as cars, are not similarly restricted. So just a few examples of this. In Delaware, you can ride a motorized scooter or motorized skateboard, but the motor has to be off. So it's like you can have a motorized scooter, but it can't be motorized. So we don't have rules that say you can have a car so long as you never turn it on. So again, sort of inconsistent rule there. In New Jersey, motorized scooters can only be used by people with disabilities. And then in Atlanta, that made some news towards the end of last year, they placed a nighttime ban on e-scooters and e-bikes. You know, no such thing as a ban on cars or a ban on transit at night, but we do ban them for micromobility vehicles. On this same theme, one of the more popular city regulations on fleets of devices has been caps on the number of devices that a city will allow. So for example, in San Francisco, the initial cap on devices was 1,500 scooters in the city, which is less than the capacity of 1 lane of traffic on a arterial roadway. So you can have hundreds of thousands of cars, but you can only have 1,500 scooters in a city. So again, not a lot of comparably consistent rules there. All right, so given these inconsistencies, that raises kinds of a lot of issues here about the rights and responsibilities. Will people know how to act if the rules are so different from each place? Things like the prohibitions on use in certain places, I think, raise a lot of questions about whether that we're really meeting the complete streets policies that a lot of jurisdictions have. And I think it also raises questions here about fairness and the rationality of our rules. All right, so given some of these problematic points with existing rules, some things that we could take a look at moving forward. Rules on segways might be something we could take a look at. Looking at micro-mobility vehicles as a whole, segways have relatively common and consistent rules, which I think is sort of an artifact of certain lobbying done by the Segway company back 15 years ago. So that might be one angle that we could take a look at. But I would also caution that when we look at rules, we may want to watch over specificity with rules. So this photo here is from the UC Santa Barbara campus. So they've got a lot of pedestrians, cyclists, and skateboarders, and thus they gave each of them their own lane. So do we now add scooter lanes? So let's have 4 different kinds of facilities. At UCSB, they had an issue where a kid showed up on a unicycle, and he got ticketed when he didn't ride in the bike lane. So he was a bicyclist out of the bike lane, but he's not a bicyclist. He's a unicyclist. So I think if we can, are there ways to write regulations so that they are crafted in a way to encompass devices that perhaps haven't yet been invented? And again, sort of avoid having 10 lanes for 10 different devices. And then finally here, I think a big question moving forward is the question here of sidewalks. So a lot of places have been putting prohibitions on sidewalks. While you probably don't want scooters on the sidewalk on the left, do you really want scooters on the road on that Orange County arterial on the right that has a 50-mile-an-hour speed limit and no bike lane? It seems like it would be much less dangerous for a scooter rider to be on a sidewalk in that case. So I think, again, some context could be helpful when we look at regulations. And then on that theme here, a lot of scooter riders ride on sidewalks despite it being illegal, but mostly here because they're afraid to be riding next to cars. All right, so that just about wraps it up here for me. I think, well, lastly here, I think there are also some lessons in history. So while we do think of these devices as new, they have been around in certain forms even 100 years ago. So perhaps looking at what happened to those devices might be instructive of how we could act moving forward. All right, and with that, thank you very much.
Thank you, Kevin. Let's everybody clap. I unmuted you. Yay.
Thanks, everyone.
Okay, so now I'm muting you again, and we'll use the participant box to raise your hand for questions for Kevin. Anybody going to raise their hand? Well, while we're waiting, why don't I go ahead and ask a question, Kevin?
All right.
Yeah, I mean, I've got a bunch of them, but I mean, it really seems to me that one of the big issues is this issue of labels and classification. And as you say, I mean, there are so many different devices. You see it around the UC Davis campus too. What do we do about that? I mean, is that a key to really kind of fixing this and getting the right regulations and the right data about safety? And who out there might be able to do that?
Yeah, so that is where, so I think the tendency so far is like we write a separate rule for, like we have the state law for scooters, and then we have the state law on skateboards, and then we had past state law on segways, and then that ends up making us super reactive to then a new device shows up, and then by default, it's unregulated, and then so I think that leads to a lot of the angst where it's like, oh, we've got this thing that's causing problems, and there's no regulations on it, so let's just ban it. So that's where at least I'm a little bit helpful here that like SAE has come up with that micro-mobility definition. So perhaps now we could write regulations that can encompass any micro-mobility device, even ones that aren't invented yet. And then they could have a common set of regulations. But I think with scooters, what makes it particularly problematic for them is that the term scooter gets applied to things that are micro-mobility vehicles under the SAE classification to things that are almost motorcycles, which clearly have different characteristics, but have the same name. And so I wish we could have come up with a different name for scooters, or at least the scooters that we use in the shared systems. Actually, the French-speaking world has avoided this issue since the moped-type scooter is called scooters, and then the e-scooters that we think of, like the kick scooter e-scooters, are trottinettes. So they've got a different term, so they can get rid of that debate where they're getting confounded by these almost motorcycle-like safety incidents and different characteristics.
Yeah. Great. I see Irving's got a question. You want to unmute?
Can you hear me now?
Yeah.
Yes.
Okay. My question is kind of going into like the future of just micromobility in regards to new developments. Are planners going ahead in mind in designing with such, with scooters, e-bikes and such, or is that something that's still not pretty prevalent? Because like obviously we see these the scooters and e-bikes appearing everywhere, and obviously there was no such thing as regulation really at first, or it was really fuzzy, but I'm kind of curious to know whether or if it varies by municipality, in regards to future developments, how e-bikes and scooters are integrated.
Well, I think one of the hopes is that so since we have the e-scooter riders now, and then whatever potential future devices might come up, but with at least e-scooters, we have created more demand for people who both don't quite fit on sidewalks because of the speed difference, and then also don't quite fit on roads because of the speed difference and potential safety issues. So that might be leading here to more demand for things like bike lanes, or maybe they don't get called bike lanes anymore, but medium speed kinds of lanes. And you've seen certain places start marking their bike lanes with both a bike and a scooter logo on them now. And I think some of that hope that because now there's more users, there'll be more demand and more advocacy for kind of medium speed kinds of facilities. That has made, I think, scooters and some of the and the bike community relatively they get along fairly well, whereas scooters and the pedestrian community have not gotten well at all. But I think there is some hope that perhaps there could be alliance here between bike advocacy and potentially scooter and kind of other device advocacy. But I think again, where the definition of micromobility vehicles is fitting within a certain like width box might help the planning for that, since future devices might end up getting kind of put into what fits in that classification.
So do you think there'll be like a more of a, maybe in existing places, more of a demand for new infrastructure for such mobility devices?
Yeah, so I think especially if we're talking about reallocation of road space, I think, again, it helps to have that extra demand sitting there. Mm-hmm. So one of the kind of the scooter capitals so far in the U.S. here in the last couple of years has been Washington, D.C. So they've been relatively permissive in the amount of scooter permits they've been allowing. And so they've had, and D.C. is also in the process of trying to install more bicycle lanes. So I think having, again, that new user in there is something that the district's transportation department has helped, I think, push some of those bike lane expansions forward.
Thank you.
Thanks.
Katrina, you've got your hand up. And if some of you are having trouble figuring out how to raise your hand, go ahead and chat in the chat box.
Hi guys. Thanks, Kevin, for coming out to talk with us on this lovely Friday afternoon. I'm excited to go outside. But I kind of had a question. It's a little bit tangential. So you had been talking about how the specific rules, I think it was Atlanta, that was like no e-riding at night. And that one was stuck out to me, one, by being kind of hilarious, and two, by being very very specific towards these types of mobility, which is kind of what you've been highlighting. And I was just wondering if you knew if that applied to non-motorized bikes as well. So if I had hypothetically turned off the motor in my e-bike, could I still ride it? or if like normal bikes were a-okay to ride at night. That one was just like very humorous to me, and I was just wondering if you knew anything else about that.
That I would have to go dig deeper. I'm pretty sure it just applies to e-bikes and e-scooters. But yeah, if you turn the motor off and you just wanted to push, or like you had like a pedal assist bike but you just pedaled, then yeah, would you still get pulled over if you were riding one? Which I think raises another interesting question about. So one of the things that law enforcement hasn't been a huge fan of some of the very detailed rules for separate devices, because it's like you can't tell the difference between what is that a human powered kick scooter, is that an e-scooter? I'm trying to look at it in the dark. And then especially with some of the e-bike classes, and if they have different rules there, it's like they don't look very different from each other at first glance. So yeah, so I think that raises, we come up with some of these rules that probably from a consistency standpoint shouldn't exist, and then we make them and they're almost impossible to enforce. So yeah, but there are other rules. I mean, Atlanta's the one that sticks out in terms of the scooter case. But when I was looking at skateboards, there was there's maybe about 10 cities that you can't ride one at night. So
yeah, because I had noticed even in Davis, there are skateboards around because just the infrastructure for non-motorized things is just so easy. But I'd always wondered, do they have to have a bike light or a skate light, just in Davis kind of thing?
So actually, no. In California, skateboards are technically pedestrians. So they don't have to follow any of the bike rules. You could ride with headphones in both ears. But you could theoretically, as a pedestrian, and you're riding on the street, which a lot of them do off campus. I in my skateboarding research, I did some interviews, and I had one person tell me they got pulled over for being a pedestrian out of a crosswalk while riding on a street in Davis. So even though it probably makes sense, but it was technically against the rules. But
awesome, thank you.
Sean, you've got your hand up.
Oh, okay. Yeah, sorry. Yeah, one thing that stood out to me, Kevin, from your talk definitely was with UCSD and how you mentioned that they kind of separated different users but different pathways. And something I was thinking of is with different universities, how they've kind of approached, I guess kind of policies for scooters and these different micromobility options. And if you've seen like any type of specific differences, because like I know personally, I went to Arizona State University for undergrad, and there they banned basically scooters on campus. Mm-hmm. So I'm just interested, have you seen like anything in like specific policies that have worked or haven't worked? Just kind of like, what have you seen?
Yeah, so that was so that's interesting. So these scooter companies have been kind of fairly aggressive at trying to get contracts to provide service at certain universities. So some universities, particularly those with like giant campuses, have been very eager to get contracts with scooter companies, and you'll see some campuses that have them, and then other campuses have been going like, we don't want this in any way, shape, or form. And so before I was at Sonoma State, so I was at San Jose State for a while, and so there they banned scooters after they were allowed there was no rules on it for a while. But then I'll use this as sort of a not great example. The rollout of those rules were so clunky that it almost made it sound like, okay, e-scooters are banned and you can only leave them at the perimeter of campus. And then they put up signs that almost made it seem like bikes were banned on campus. And then had a flyer that not the transportation people put out, but like the administration and finance office who handles the campus grounds put it out, and it had no transportation nuance to it that it would be understandable from a transportation planning standpoint. It looked like it was made in like Windows 95, and so it was, I think, more it was extremely unclear. So I think there is definitely different, responses out there from campuses. But yeah, there are some cases where they are being used.
Okay, thank you.
So we are just about out of time, and I don't see any other hands up. So maybe I'll just ask a final question, which is kind of two parts. And I'm not sure it's even answerable, but, scooters were a month ago, 2 months ago. There's kind of, I guess the first question is, where do you think they were headed? Was this just a flash in the pan, or, was this going to be a lasting addition to our transportation system? Were people going to, was there going to be more personal devices once people tried out these shared devices? Kind of where you think it was going? And then, of course, we've got what's happening now, and I'm worried about some shakeout in these companies and whether they're going to rebound. So I don't know if you have thoughts about those things.
Oh yeah, so there's definitely, I think, a lot of there's a lot of things that could happen to the scooter industry. So on one hand, ridership, has been pretty strong in places. There was the estimate in the U.S. was something like there was 48 million rides on them, and that appeared to be growing at a pretty decent clip. And we saw use of them in cities all over the world. So it did seem like as in terms of something that people were finding valuable and wanting to use, it seemed like there would be demand for them should they continue to exist. Now, the thing that was becoming a bit concerning for the long-term viability for the scooter companies is they have a bit of Uber and Lyft in them, in that they haven't been making any money. And so there, I think, was still an open question about whether scooter share companies are they structurally unprofitable, or is that something that could get fixed over time? Particularly because the thing that was costing them a lot of money was that the devices weren't lasting very long. So they were picking things that you could buy off the shelf at a store and then putting them in public and having lots of people use them in a given day. So I was curious to see whether a lot of the companies have come up with like third or fourth generation scooters, and whether those would have enough of a lasting ability to then cut the costs down. So I think that was, I think it's the open question to me as to whether the share systems could survive or not. Now, some people also thought that these wouldn't last because people would move to private scooters. And I think there is some evidence that now that I've ridden a Lime or a Burn, that seemed like a good idea. Let me get my own. But I think it's sort of the same thing like with personally owned bikes and shared bikes. Just because you could own a personal bike doesn't mean you wouldn't use or wouldn't find a shared bike to be useful. So I think for lots of these unplanned trips, or for people who might commute into a big city by train or by car and then want to go around the city during the day, there would still be demand for shared devices, even if other people might want to use private devices. So I don't think I think there could be a shift to some private devices, but that wouldn't get rid of the shared devices. And then as for the whole current situation, where now obviously there isn't as many rides going on, and so the companies aren't making as much money, I think there could be open question about whether now these companies can pay their bills and survive to the end of the crisis. On one hand, though, if they are losing a lot of money, maybe the fact they haven't been giving rides means they'll lose less money this year because their devices will last a little longer here. They won't need to buy a new fleet so soon. So that might be a bit of a double-edged sword there. And then perhaps it could also be, I could see a scenario where the current crisis makes things easier for scooter companies to survive, just not the current ones. So the current ones die, and then new companies buy their inventory on pennies on the dollar, and then they start from a more advantageous financial position and then so they can now write out. The past companies worked out all the kinks, and then now they buy this stuff for cheap, learn all the lessons, hire the same people perhaps, and then they're now on a more financially stable footing moving forward. But that will definitely be something that's interesting to see what happens.
Yes, it will. We'll see what happens. Well, Kevin, thank you so much for doing this and being our guinea pig, and we'll get you back here in person one of these days. So again, I'm going to unmute. We'll officially end the meeting, but maybe I'll keep the meeting running for a little bit in case anybody wants to chat.
For sure. Have
Thank
fun
you.
Friday.
Thanks, everybody.
Thanks, Kevin.